is the first ever regional meeting on behavioural and cultural insights for health. We've got 120 people here representing mostly public health authorities, but also partner organisations. And everybody's here to discuss how we can advance the implementation of an action plan which we adopted last year.
If we're going to tackle some of the most crucial, important and wicked health problems in our region today, we've got to do a better job of understanding behaviours. We've got to understand the barriers to behaviour and the enablers.
In the Netherlands, we used BCI during the COVID pandemic to follow closely all the determinants involved with COVID behaviour, to be able to feed directly into the COVID strategy and make adjustments while the pandemic was still going on.
To encourage cervical cancer screening in country of Georgia, we rigorously examined BCI-informed messages. And this is very exciting because it allows us to use the most effective messages in our national communication campaign.
It means that we're bringing together the disciplines that will allow us to better understand society. And that's what this meeting is about.
Because of the regional resolution adopted by member states last year, for the first time ever, public health authorities have now reported to WHO on their activities, on their implementation related to behavioural and cultural insights within the region. And then for us to better understand what drives this, we have conducted an interview study with the same member states. And the outcomes of those two reports have been shared here at the meeting, and we're now engaging in a discussion to understand what are the drivers, what are the opportunities, but also what are the challenges, and how can we overcome them together.
There are very specific and important gaps that need to be addressed. There are gaps in knowledge of behavioural and cultural insights, and there are gaps in skills. Another challenge is that communication pathways to decision makers and time pressures hinder the effective use of insights to improve policy and implementation for better health.
There is a lot of enthusiasm and interest in applying BCA to health. Unfortunately, in the many countries, there is a gap in delivering on commitments to invest resources, engage with the stakeholders, and holistically embedded BCA into policy planning.
The meeting has been a really good opportunity for us to discuss concrete and actionable next step the coming years. It has been highlighted that we need to demonstrate the added value of this work as well as the impact and cost effectiveness.
I think WHO and the international and regional partners have got a vital role to play in unlocking BCI for better health. And I think that can happen through facilitating country dialogues for us, through collecting, analysing and disseminating notable practice.
European region has had several years in developing the strategy and approaches to promoting behavioral and cultural insights. We are also looking at how to institutionalize this. And I think the takeaway from here is that it is something not only important and necessary, but it is something really doable and definitely of high impact.
И хотелось бы поблагодарить ЕРБ ВОЗ и команду АПКФ за создание таких условий, за техническо-консультативную поддержку и создание условий для обмена опытом с другими странами.